Hey everyone, how's everybody doing today? I hope your NCLEX reviews are doing okay. I hope you guys are staying safe. Hope your families are well. I know in the past video I did went over cirrhosis fairly briefly. No, somewhat actually, we actually did go in depth a little more on cirrhosis. And on this really quick video, I just want to go over some of the diagnostics for diagnosis and treatments for a patient with cirrhosis. And so, as we all know, cirrhosis is basically scarring of the liver, which can result in distortion of the liver and structures of the vessels. And its most common causes would include alcoholism and hepatitis. And as we all know, there can be some nodules that can develop in the patient with cirrhosis that can block the blood flow of blood in the liver. And because of this, it can eventually damage the liver and shrink the liver and can lead to complications that can be severe and even life-threatening. And we already also went over some of the major complications such as portal hypertension, right? And with portal hypertension, eventually it can cause increase in pressures. It can result in obstruction of blood flow and cause the blood to eventually find a channel around the high pressure area and even cause more complications such as ascites, which is basically fluid accumulation in the peritoneal cavity, right? And also we also went over several other complications such as hepatorenal syndrome, right? And we also went over some life-threatening complications that is associated with portal hypertension, and that is bleeding esophageal varices. And like I mentioned before, there's a backup of blood from the liver and it gets into the esophageal and the gastric vessels. These vessels in turn becomes distended and they bleed. And so those are major complications that you do have to understand and know for your NCLEX exam. And so in this video, I just want to fairly go over some of the diagnostics that you do have to know for your NCLEX exam, right? Now, as we all know, liver functions are complex, so it basically requires several diagnostic tests. And, some of these tests are determined and are used to, determine the extent of the cirrhosis. And the type of treatment depends on the condition of the patient's liver. Now, some of the major diagnostics tests that you do need to be mindful about would include obviously laboratory tests. So we're gonna check the liver enzymes, all right, and usually there would be an elevated LDH and elevated AST for the patient, and there would be a prolonged prothrombin time, okay, and obviously the ammonia levels would be increased, right? Another test that we can use to diagnose our patient would be upper gastrointestinal x-ray, right? And also CT scan. And we're also going to do liver ultrasound on the patient, okay? And lastly, we are going to be able to use EGD, or what we call, it's a long word, bear with me guys. It's basically called, let me see if I can remember, esophagogastroduodenoscopy, right? So again, EGD or esophagogastroduodenoscopy, which is basically a procedure that it examines the esophagus, the stomach, and the first portion of the duodenum, which is the small intestine, and we're going to be using a long flexible tube with a camera at the end, right? And the scope is inserted into the mouth and is advanced towards the small intestine, okay? And the doctor may perform this procedure to diagnose and to treat certain possible disorders of the upper GI tract, and also eventually, you know, find out any complications that has um, that has been affected by the cirrhosis. Okay. Now we're also actually gonna do liver biopsy for the patient. Okay. And I didn't put it here, but liver biopsy is actually a major diagnostic test that we can give to our patient. And understand that when we are giving or performing, or when the doctor performs liver biopsy in the patient, we do need to frequently assess the patient for bleeding, okay? And that's why coagulation tests are usually done prior to the procedure for this specific reason, right? Now, let's go over treatments. So, the treatments for these clients is based on the symptoms that the client is exhibiting, obviously. Now, for example, if the client is retaining fluids, diuretics would be prescribed, right? Also, dietary interventions can include a diet that can, promote healing of the liver tissue. Now, usually the client would need increase, so high calories, also increased proteins, but low sodium food sources. Okay? Now, one thing I want you guys to take note is that if the client has an advanced liver disease, or if the complication has already led to what we call portal systemic encephalopathy, right, or PSE, with this patient, protein sources are restricted due to the liver's inability to convert protein to urea for excretion, right? So the liver now has a hard time converting protein to urea to pee it out. Therefore, protein sources would soon be restricted, right? So you would have the patient in a low protein diet. Now, medications usually prescribed for clients with cirrhosis would include antacids, obviously for gastric distress, and because due to the fact that it can lead to bleeding. Now, diuretics can also be used for fluid and ascites, okay? And cathartics and enemas, such as lactulose or cephalac, is actually used to correct the pH in the bowel. And one of the major things that we do want to be able to do to our patient is get rid of ammonia from the body, right? And those cathartics and enemas, specifically lactulose or cephalac, which I believe is a major drug that you do need to know for your NCLEX, can help correct the pH and get rid of this ammonia, okay? So that's it, guys. I just wanted to fairly go over, diagnosis and treatments, and kind of review some of the high level and low level complications of cirrhosis. Um, that's it for now. On the next video, I think I still want to go over some of the procedures or surgical procedures for cirrhosis, and if not, I will probably go and venture out and talk about pancreatitis. But that's it for now in this review, guys. I hope you guys are able to understand and take some notes of today's review. I really appreciate you guys. I just wanted this review to be short and sweet. Make sure to subscribe, and I will see you in the next video. Thank you, and God bless. Bye bye.